Invest in Ethiopia, one of the fastest growing economies.
The Ethiopian government recognizes the central role of healthcare in improving the well-being of citizens, as well as spurring economic development. In this connection, in the nation's multispectral growth and transformation plan, health has been an area of immense significance and focus. In fact, for over 2 decades, the government of Ethiopia has had a health policy focusing on package of primary healthcare services that aims at essential public health. The services have included preventive, promotive, and curative components. The well-thought-out policy has led to impressive outcomes. The report card for the nation highlights remarkable attainments in access, reduction of maternal mortality, and increase of child survival figures. Communicable diseases that once were a major threat are now decisively under control. The government believes private actors have an indispensable role to play in taking the nation's health sector to even greater heights. For this reason, there has been a progressive rise in the role of the private sector.
Over the last 20 years, you can see that the private sector has flourished a lot. I mean, in Addis Ababa alone, we have hundreds of private clinics, almost dozens of hospitals, private hospitals, many drug and medical equipment importing firms, and so on. So this happened, over the last 2 decades.
In line with the steadfast move to deliver basic health services in all parts of the country, the government has been exerting efforts to enhance the figures of medical facilities at all levels. In this regard, the involvement of other actors, most notably the private sector, has been particularly important.
We have developed a 20-year envisioning document. We call it Vision 2035. One of the things that you see in this big 20 years document is actually the involvement of the non-state actors, the private sector, civil society organizations, and so on. So we consider them as development partners. We consider them as good alternatives, and so on. We believe that we have to harness the potential of non-state actors, the private sector, and the civil society organizations.
Unmistakably, creating opportunities for the private sector to engage in health investment has been one of the areas of critical intervention for the government. In this important area of public health, the private sector is extensively engaged in providing primary and secondary health care through a range of modern medical establishments, including advanced hospitals. To support and enhance the role of the private sector in health service provision, the Ministry of Health continues to encourage investors by providing various incentives. The ministry's support has led to a substantial increase in health investment and a significant rise in the number of medical establishments.
The investment policy of the country is very favorable for those who have the plan to invest in such truly tertiary hospitals and pharmaceutical industries, and so on. Starting with the duty-free privileges, including the granting of prime plots of land in the cities and in the other parts of the country as well.
The government was very supportive, when we started this project. It has allowed us, to get the investment permit, so quickly. and has also facilitated, the import of equipment and capital goods are free of tax and duty.
At present, the private health facilities that are flourishing across the country are introducing a wide range of services. Services that were not locally available in the past are now being introduced in a broad spectrum of specialties. Many private hospitals process state-of-the-art medical technology and provide curative service of high quality. Bethel Teaching General Hospital is a private establishment that came to the scene some 13 years back. The scope of the hospital's service ranged from internal medicine to intensive care.
We have surgical services. Among the surgical services, we have specialists in different fields of surgery.
Bethel is the first one to introduce an open system MRI in Ethiopia. It was implanted first in this hospital 8 years ago. Prior to that, people were going abroad to have this service.
This is a very expensive and latest equipment and the latest technology. The name is nucleosens EZQ. In our setup to assess viral load, for example, for those patients who are lived with HIV. So for the monitoring and controlling process of the treatment, we are always using this equipment, and the result is highly sensitive and accurate.
The Korean Mangsang Medical Center is another private provider located in the heart of Addis Ababa. It was established in 1994 as a tribute to Ethiopia's participation in the Korean War 60 years ago. Hemodialysis is one of the services the medical center gives to patients suffering from acute and chronic renal failures.
We connect our patients with vascular access and dialysis machine, and the work of this dialysis machine is to replace the kidney function, and the patient have lost their kidney function and they live with this machine, and we dialyze them at most 3 times in a week.
Mangsang Medical Center also offers imaging service through angiography. This is an imaging technique and a procedure that uses spatial dye and x-rays to see how blood flows through arteries in the heart.
Now we are in angiography room. It's related to blood vessels, and sometimes subcutaneously we drain some abscess and hematoma and bile products. We proceed here so many things. We use catheter and drainage catheter, also there is pigtail catheter, Irish catheter, and we serve for our patients more than 20 cases or 20 diagnostic procedures.
As a result of the government's diaspora engagement strategy, growing numbers of diasporic Ethiopians are coming back home to do business in different sectors, including healthcare. One good example is Washington Medical Center, established by a group of diaspora-based Ethiopian physicians.
What we're trying to build is, this center is going to be a platform for all interested, willing physicians who are trained in Ethiopia, who are practicing already here, who would like to join us in providing an excellent patient-centered care. And also it's going to be a platform for all diaspora physicians who want to come home and start practicing here, so they don't have to start from scratch. They can join us, and a lot of diaspora physicians are going to come part-time to see patients, care for our people, population in Addis here and in Ethiopia. And this is going to give also a portal for a lot of diaspora physicians and as a professional who wants to move into Ethiopia and set up their own centers.
Washington Medical Center eyes at bringing Western medical expertise and standard of service to offer patient-centered clinical care in Ethiopia. The diaspora physicians like Dr. Marcos and Dr. Fasil are committed to bringing home the vast experience and knowledge they have acquired in the West.
Our doctors bring knowledge and skill and experience of working in the Western world, more specifically in the United States and Europe. So when they come here, they don't necessarily bring all the gadgets and the equipment with them, but they definitely bring their seasoned experience, the management of a healthcare business, the patient care, the standard of care, the communication. So they can be a good option here. That's what we believe.
The different private hospitals are not only providing modern and high-tech medical care, but also contributing to manpower development in the sector. Their contribution will definitely help to narrow the skills gap.
We have been training nurses, so we produce around 800 to 1,000 nurses. So they have been working in different parts of the country, in different health institutes. And now we are, health officers has been, produced around 400 or 500 health officers. They are working in different parts of the country. So
we are also training doctors, not only treating here. We are undergraduate trained medical doctors. We are training surgeons here with collaboration of Pan-Africa College of Surgeons specialties. In the near future, we are also giving specialization in internal medicine, obstetrics and surgery, because of the need of surgeons and obstetricians is very high.
The government encourages these private institutions to be tertiary health facilities that can offer advanced service in the treatment of acute health problems. It also endeavors to draw other investors to join the sector and build advanced medical facilities that can provide international services.
Considering the demand of citizens, considering the need and so on, the private facilities, I think, have to be more engaged in making sure that they are availing the advanced services that are forcing citizens to go abroad to seek some treatment in some of the areas.
By way of addressing the existing gaps in the health sector and the global advances in healthcare, the hospitals have set short and long-term plans to expand service and to offer advanced state-of-the-art care in a variety of specialty.
always we are trying to be ahead of anything, so there are lots of services which are not available in this country. For the short plan, maybe in few months we'll start with this IVF service. This is in vitro fertilization. A little bit later we are having a plan to have a renal transplant. So that is our third plan in the near future.
At this moment we are building new hospital which is going to be used for this service. And after the construction of the new hospital, which will be finished this year, we are going to have a cardiac center, only just a cardiac center. So by doing this, these specialties, I think we are going to hold chronic patients here.
Once these facilities become tertiary service providers, patients can expect high-quality service in more diverse areas of medicine, and the nation can hope to become an important destination in African medical tourism.
The local community, that flocks into Thailand, India, South Africa for better treatment is a lot. I mean, you can't really believe, the figures. So the country is still losing a lot of hard currency.
Formerly, people are going to well-developed countries from underdeveloped countries to get special services. Now it is not. People moving from well-developed country to underdeveloped to get cheap medical services. So that's called medical tourism. So what we are wishing is that even though that we cannot stop it, we can attract others from Somalia. Now we have many patients who are coming from Somalia, from South Sudan, from Djibouti for the time being.
We are members of the Ethio-American Doctors Group. That's an entirely different project. It's a very huge project. It's a tertiary hospital. It's going to be built in Addis. The investors are all physicians who have put up their money to start the hospital, and the Ethiopian government is also our partner. And we're going to partner with many other different organizations in Europe and the United States to make this thing a reality. When that tertiary hospital is built, then we're going to have a center where you don't need to go anywhere else. It will be available here. Like the cancer center will be state-of-the-art and probably the best in East Africa. And the cardiac center and the neurosurgical center is going to be state-of-the-art.
Patients at the private medical facilities all along appreciate the way the hospitals handle their clients.
I came here to get the wound on my tooth treated. I've also a kidney problem. My health is tremendously improving after getting treated here. I had the chance to see some public and private medical centers. This one is by far better than others. My wife used to suffer from intestinal complications. She underwent surgery and now she's better. The service here is excellent with a special follow-up and support.
Ethiopia is a growing diplomatic hub and the seat of regional and international organizations including the African Union and the United Nations Economic Commission for Africa. The expatriate population serving these and other organizations is growing, and the nation at large is home to 90 million people whose incomes are growing. The health market is certainly extremely big. There is no doubt that the health investments are profitable and viable.
Take Addis Ababa, right? I mean, the number of embassies, the number of international organizations and so on. You know, almost, I would say, all of the diplomatic community do access their health care in other countries. So if there is a very good facility, you know, standard and so on, so this community would love to have the treatment, the service here in the country.
The health sector is a very profitable market. You know, we have, Ethiopia, as you know, is one of the fastest growing economies in the world. So we have, people who get into the middle class, upper middle class, much more quickly than, some other places. So, obviously the health-seeking behavior will improve, with the infrastructure expansion, with the growth of economy. The demand will also increase proportionally. So there will not be any worry about, the profitability of, the healthcare market.
There has to be much more investment from the private sector. There has to be involvement of the private sector in order to help the private hospitals, institutions. If there is big investment in healthcare from the private sector, we should be able to have excellent centers.
There is a marked increase of accessibility of healthcare for all segments of the population, and the private health sector has been and continues to be a significant actor.